Well, good evening, everybody. Welcome to our community focus show here on Channel 6 TV. Glad you could join us tonight. This is Kenny Fogel, and hope you'll have a good show tonight. We do as much as we can to educate, inform, and have a little fun in here sometime. We got Jan Tronzo with us today. Jan, first of all, welcome to the show.
Thank you, Kenny. I'm glad to be here.
Well, and you've been working now for a few years with the Nelson County Community Clinic.
Yes, I have.
And a lot of people may or may not know what that is, but if they don't, what is it?
Well, the Nelson County Community Clinic started 9 years ago, and I started there as a volunteer, and my sister was the executive director at the time and moved on after 5 years, and so I've been executive director for the last 5 years.
Yeah.
So we're just coming up on our 10th year, and it is a 501c3, which is a charitable healthcare clinic for the working uninsured of Nelson County. But we do reach out to other counties in the surrounding area with things like prescription assistance. You know, if we have a physician who refers a patient from another county, they might be going to local physicians in town and they need assistance with some medicines that say their insurance won't cover, or they just they're living in the poverty level and cannot afford it. Then they'll come in to see us and we'll help them, you know, fill out the applications and begin to get that prescription that they need. So it's a wonderful service. We provide medical, basic medical care, dental care, vision services. So some people will even get glasses from us. I'm applying for some grants right now, Kenny, that's going to give us hopefully some help with dentals. You know, people need dentures.
Absolutely.
We've been pulling a lot of teeth. Last night we pulled 19 out of 7 people. And these are folks who haven't had a chance to have dental care before. And they're going to have some dentures down the road. And so I'm applying for a grant that will help them purchase those dentures. And I secured an area that a provider that would get dentures for about $400. So if I could give them $200 and they could save up $200, then they can get their dentures.
Absolutely.
Another thing is hearing aids. You know, we've got a growing population of 65 years of age, you know. Us baby boomers are all coming up on that. And hearing aids is one thing that is an issue in this community. So we're going to try and help them with some of the funding for that, if I can get the grants for it. Okay.
Well, let's just go back to the basic mission. You've been there since day one pretty much. And the mission basically is for people that are working but are either uninsured or underinsured. I mean, how did they come up with this particular mission? Did somebody see a need out there for this, or how did they determine that?
Well, there was a 3-year study, and there were 8 or 10 people on the team, and they actually studied what the needs were in the community. And, you know, that took place 13 years ago. So the needs have changed, as you know. And with the Affordable Care Act, everybody supposedly has insurance now. And so a lot of these folks can't afford to pay their co-pays, or they can't afford to pay for their medicines. And then there are just some people who just cannot pay for the insurance. So we still have a small group of people who come in for medical visits. When you get into, the Affordable Care Act, a lot of those insurance don't provide dental, or vision.
Or very high deductibles.
And Medicare doesn't either. So we provide that for those people who can't afford it. But our mission really is to fill the gaps in the community as it relates to healthcare. And so when the gaps change or the needs change, then we start to change. And one of the things that we're looking at in the future, and I've got a board meeting coming up next week, to discuss it more, is they've got a new program called Counseling for the State Health Insurance Programs. For example, if you are getting ready to fill out your Medicare or Medicaid, that's a really tough process to do. I mean, you've got to know computers, you've got to be able to fill out all the paperwork, and honestly, our aging population didn't have that experience with computers in the past. So a lot of them are, disadvantaged as it relates to that. So we're going to help counsel them and help them get signed up for their Medicare and Medicaid. And we'll find a lot of those patients are going to need prescription assistance, and we'll help them with that. So it's a wonderful service. It is provided by total volunteers.
Well, that's my next question, basically, of volunteers. I know you actually have, you don't have regular volunteers like a lot of people do. You actually have doctors and dentists and vision experts.
Oh, yeah, absolutely. We've had 5-figure, and I want to say like 47,000 hours of volunteer hours. And these are...
Well, if you had to pay these people, it would be expensive.
Exactly. And that, we come up with our value of service. We don't charge anything for our services. The patients get any service they get from us free. Even the medications are free. But if we had to put a value on those services, you'd be looking at about $3.5 million worth of services, because you have to pay your dentist, your doctors, your nurse practitioners, your hygienist, The pharmacists, we used to have an on-site pharmacy. Now we provide them with the prescriptions. We don't need that right now since people have gotten their insurance, through the Affordable Care Act. But we still have an agreement with 2 local pharmacists, and they provide those prescriptions for us as we, give them call in to tell them what we
And your setup basically is, if somebody come in right now, they couldn't distinguish that from any other doctor's office or dentist office.
Oh, it was
you
a beautiful doctor's office.
Yeah.
We're on 300 West John Fitch Avenue, which was Dr. Dew's old office. And on one side, we have anybody that ever wants to come visit us. We're open Monday, Tuesday, Wednesday. We love to show it off. We're very proud of it. One side's set up for our medical and the other side's for our dental. Everything in the facility was donated.
Yeah.
We started out with about $277,000 grant. It was a 3-year grant from Flaget's parent company, which is called Catholic Health Initiatives. Right. And so we took that money, and over 3 years, we started our process in a government house out on Robin Lane. I don't know if anybody remembers that, but it had 3 bedrooms, and we
I know where Robin Lane is. I guess
right. We outgrew that house. We outgrew that house in 6 months.
Yeah.
It was so funny. So Bobby, knew that all the doctors were moving out to the new facility across from the hospital, and jumped right on it and tried to lease that space over there, and we've been able to lease that ever since.
Is there any other places around there that have anything like what you have? Do you model it after something else, or you just created it?
We did. We modeled it off of one in Hardin County. Now there's 40 some odd in the state of Kentucky.
Yeah.
And Shepherdsville has one. I want to say Taylorsville might have one. I might be wrong about that. But anyway, free clinics are around the country.
Right.
And we belong to an association of free clinics. So there is somebody out there that gives us some guidance, in terms of what's happening.
So you're not all alone out there.
Right. Yeah. And, the beauty of it is it's a community clinic staffed by the community for the community who are disadvantaged.
Trained medical people in the office.
And supported by the community. Let's talk just a little bit about how we get our money. United Way has been a wonderful, donor to us for the full 9 years that we've been in operation, and we couldn't do without it.
Right.
They provide us about 1/10 of our total budget. Our budget runs about $180,000 a year. It's not much, but we provide $3.5 million worth of services.
Pretty good return on the investment.
We feel like it is. It's not that every year, we don't get that good of return on investment. That was probably 2013 or 14.
Yeah.
But still, it's a great return on the investment, and we see all the patients that ask to be seen. But we're funded through grants. We have 2 annual fundraisers, the 5K Walk Run and the Dinner with Art Auction. And we also have a lot of wonderful community supporters that, donors that just consistently give to us every year. And a lot of those are people that were on that original needs assessment board that said, hey, this is a good thing.
Well, the health of the community, I don't care what community you're in, the health of the community has to be at the top of the list of just about everything, whether it's physical health, mental health, dental health, vision, and again, hearing. Again, you touched on that a lot of people don't think about. That gets sort of shoved to the side sometimes, but you're providing that as well.
Yeah, and we try very hard, Kenny, not to duplicate anything that the government provides for. Like the health department will provide a lot of the female exams. We don't do that, and CommuniCare will provide psychiatric counseling. We don't do that. So we're trying hard not to duplicate services, but to provide where the needs and the gaps really are in our community. And I think that's what's made us successful, and that's what's made the community reach out to us. Say, for example, if you don't want to volunteer or don't have the skills to volunteer to help us at the clinic, we have people come out and volunteer to help us at our 5K Walk Run or Dinner with Art Auction. And that generates, those 2 fundraisers alone generate almost 60 to 70% of our budget. So, we work hard to
It's a lot of work. I know you'll put a tremendous amount of work into that. So it's not easy.
It's a wonderful event. It's a good community event. I was talking to some of the dentists before, and they said to me, you know what, Jen? They said, we didn't know a lot of the doctors in, you work every day. And we don't know a lot of the doctors in town. We didn't know a lot of this or that. We knew them by name, but we never had really gotten to know them. But since we started volunteering at the clinic, you get to know them, number one. And number two, you go to dinner with them at the Dinner with Art Auction, and you sit at the same tables, and you just become friends, So it's great. And, the United Way contribution that we get comes from the community as well. So it's community giving back to the community. So I don't know if folks realize that when they give that donation through United Way, maybe through their tax or their payroll deductions, that when it comes back, they might be helping their own brother, their own sister, their uncle, their aunt, because everybody has hard times sometimes. And all you have to do is To qualify at our clinic, you have to be working, uninsured, live in Nelson County, or fall in the poverty level.
Yeah.
And people say, well, Jan, I know somebody's coming there that's not working. Well, no, they may not be working because they might be disabled.
Yeah.
You know, or I might have a retiree at 65, 69 years of age that needs to have his teeth fixed, and he just doesn't have the
So
income.
people ought to check that out, whether they think they're qualified or not. At least they ought to stop by and ask you the question or give you a
Yes,
call. Now, if somebody wants to
absolutely.
find you again, you say you're in that John Fitch building or what?
Yes, 300 West John Fitch.
So if somebody wanted to find that.
Right, it's right behind the library,
Uh-huh.
right behind Bethlehem High School.
Okay.
And it's the 2-story red brick building that's across from the other medical facilities.
Okay. And you're open Monday, Tuesday, and Wednesday.
Right.
So somebody just wants to, now they need appointments or they just drop in?
You can give us a call. We have an answering machine on 724, and the number is 348-5990. You can drop in anytime you want. We may or may not be there. 9 to 5 typically on Monday and Tuesday, 9 to 2 on Wednesday.
A lot of it depends on what, I guess, the availability of doctors and dentists too. don't it?
Exactly.
Yeah.
Now we have our clinics in the evening, like we'll have a Monday night medical clinic and a Tuesday night dental clinic. And the reason we do that is because most of our patients are working.
Right.
We do have one dentist that'll come in at 3 for those patients who are working the second shift.
Yeah.
So we see them from 3 to 5 and then they go in on their second shift. But we are there, and don't come in the evenings, what I'm getting to, because Monday night and Tuesday night we are rocking and rolling with medical and dental clinics. And but during the day, we're trying to get ready for those, and we'll take anybody that.
So you're looking for clients, volunteers, and donations.
Absolutely.
And that's what makes it all work.
That's the way we live.
That's exactly, and that's what makes the community a better place to live.
Yeah.
Well, it's fantastic what you're doing there. And whoever come up with the concept years ago, thank them, and thank you all for just continuing to do this, because it is a need that unfortunately is not going to go away anytime soon.
Absolutely. You know, I retired a little while back, and I started back into this job, and it kind of feeds my soul. You know, it's something that feeds me. So it's a
when you see somebody walk out, and I know it's painful to talk about people getting their teeth pulled, but if you've got bad teeth and you need the help, it's a pleasant feeling when you leave there and know that you've gotten service and good quality, high professional service, and usually at little to no cost.
Yep.
So that's fantastic.
We have a lot of diabetic patients, you know, on our medical side, and we do flu shots, and we try to do preventive care as well for our patients. And we have a thing called the Prescription Assistance Program. So if you are out there and your physician doesn't know about this, you can actually come to us and ask, will I qualify for assistance with my prescriptions?
Yeah.
And they're typically the ones that are very expensive, like insulin's $1,000 a month. Most people can't afford that.
That's a lot of money.
And insurance has a hard time paying for some of those real expensive ones. So we're able to go through the Kentucky Prescription Assistance Program, sign them up through an application, and see if they qualify by using their 1040 tax forms. And the pharmaceutical companies give them that medicine for free. So it's wonderful. It's just knowing how to make it happen.
Exactly. It's knowing the red tape and knowing and having somebody like you there to do it. And so again, the resources just in it alone is worth the effort. So.
And we need some volunteers. We do. We're in need of some people that just want to help us out on the desk during the day, you know, answering the phones and directing our, clients to whatever person would help answer the question they have.
Well, you just keep doing what you're doing. The Nelson County Community Clinic, Jan Tronzo, we appreciate you being here. And again, a telephone number if somebody wants to give you a call.
Area code 502-349-5990.
All right, well, give them a call at the Nelson County Community Clinic. If you think you qualify or somebody else, just give them a call and find out. You know, it never hurts to ask. The worst they can say is no. But again, you might say yes. So give them a call, find out how you can be helped. The health of our community is tremendous, and the work you're all doing is absolutely invaluable to us.
I'm honored to do it.
All right, well, thank you. And we'll be back in just a few minutes here on Community Focus right after this here on Channel 6 TV. Be right back.